In this presentation, we'll be going over the gut domain. Our learning objectives are to understand the gut's impact on health, uncover metabolites associated with gut health, explore the utilization of digital twinning to cause favorable shifts in gut health. Our outline will look briefly at etiology and pathophysiology associated with gut health, explore some symptoms of dysfunction, and also highlight some traditional lab testing. We'll also explore the metabolome, the metabolites that we capture for this domain in the Aristotle test, and also a rationale for selection of interventions affecting gut health via our digital twinning models. So a bit of background. The gastrointestinal tract is a complex system responsible for the digestion, absorption, and elimination of food and waste in the human body. It comprises a series of interconnected organs, each playing a unique role in the digestive process. The gastrointestinal tract is vital for overall health because it's really involved in the breakdown into food into nutrients, which are then absorbed into the bloodstream and utilized by the body for energy, growth, and repair. Additionally, the gastrointestinal tract plays a crucial role in immune function, with a significant portion of the body's immune system located within and around the gut, approximately 70%. In addition, the gastrointestinal tract houses the gut microbiota. Estimates suggest that there are trillions of microorganisms residing in the gut, including not just bacteria, but also viruses, fungi, and archaea. So in terms of gut symptom and disease prevalence, this is actually very problematic, particularly in Western countries. For example, in the United States, in a recent survey, 61% of individuals that participated reported experiencing at least one gastrointestinal symptom in the past week. And this affects both males and females. Some of the most frequently reported gastrointestinal symptoms include things like heartburn and reflux, abdominal pain, bloating, diarrhea, constipation, and there are a cluster of specific disorders that generally are associated with these different symptoms. Interestingly, when we look at chronic digestive diseases in the United States, an estimated 11% of the population does suffer from at least one chronic digestive disease. And this prevalence is a lot higher in older individuals. When we look at individuals over 65 years and over, it's about 35%. Common symptoms can affect both the upper gastrointestinal tract and the lower gastrointestinal tract, ranging from things like an upset stomach, acid reflux, abdominal pain, nausea and vomiting, and even unintentional weight changes, whether we're losing weight or gaining weight. And a lot of this can actually be contributed by bacterial overgrowth or imbalances in nutrients, again, relating back to how we're absorbing our nutrition. Common conditions can range from irritable bowel syndrome to peptic ulcers, and even celiac disease, an immune reaction to gluten that damages the small intestine and can cause diarrhea and malabsorption. Looking at some of the highlights of pathophysiology of gut dysfunction, we know one of the big issues is alteration in gastrointestinal motility, and different factors can lead to changes in peristalsis, the movement of the food through the digestive system, which can contribute to issues like IBS. Also, changes in gastrointestinal secretion, increased intestinal permeability, more commonly known as leaky gut, impaired mucosal regeneration and blood flow, an imbalance in the microbes that we are harboring in our gut called dysbiosis, and even far-reaching consequences such as gut-brain axis dysfunction. Also, altered bile salt metabolism, abnormalities in serotonin metabolism, and even genetic factors. We know certain genetic predispositions may contribute to the development of different gastrointestinal conditions. So in terms of lab offerings, there are more traditional tests like the fecal occult blood tests, stool cultures. Of course, now we have sequencing a lot more widely available for profiling different microorganisms. Also, broad proxies like for carbohydrate digestion, we can take breath tests, blood tests, imaging studies available. What we'll go over today is assessing metabolites via metabolomics. So our test for the gut health metabolites includes tryptophan metabolites. So tryptophan is an essential amino acid that can be metabolized by gut bacteria into various compounds such as indoles, which we'll discuss, as well as various amino acids. For instance, histidine, which can also be metabolized by gut bacteria. So In terms of the tryptophan metabolites, we know there are several different pathways that are downstream of tryptophan. Tryptophan metabolites are primarily generated through pathways like kynurenine and serotonin, which play critical roles in neurobiology and immune modulation. Implications of a low score in this subdomain generally are indicative of neurological issues. We know that reduced serotonin can contribute to issues like depression and anxiety, also immune dysregulation, and gut dysbiosis. Low indole levels can weaken gut epithelial health and immune modulation. In terms of high tryptophan metabolites, this can translate to inflammation and autoimmunity. Serotonin syndrome, basically high systemic serotonin, can lead to an overactivation of serotonin receptors, causing severe psychological effects, and also toxin accumulation. So you don't want to have low indoles, but you also don't want to have elevated indole derivatives, because these can indicate microbial imbalance and contribute to intestinal and systemic toxicity. So there are many different derivatives. Some can be beneficial, others can be problematic. Metabolites like indole propionic acid and indolactic acid have been associated with anti-inflammatory effects, which may help protect against various inflammatory conditions in the gut. Whereas others associated with the decarboxylation pathway and transaminase pathway, if their levels are too elevated, can result in some imbalances. For instance, an imbalance favoring indole production has been associated with chronic kidney disease, while indole 3 lactic acid and indole 3 acetic acid are generally seen as protective. So the kynurenine pathway, this is another really important one to focus in on, as it plays a crucial role in regulating intestinal inflammation. Also the serotonin pathway, as this converts tryptophan into 5-hydroxytryptophan and then to serotonin. And these metabolites are important in gut health by activating certain receptors linked to maintaining gut permeability, which enhances intestinal barrier function, stimulating gastrointestinal motility and hormone secretion, exerting anti-inflammatory and antioxidative effects, as well as modulating gut microbial composition. So the way to really balance these levels is ensuring adequate fiber intake, different types of carbohydrates that are what we call microbially accessible. So they reach the gut and the bacteria there can work on them and produce beneficial metabolites. Also, we want to make sure that we have the presence of specific bacterial species, which we'll get into a little bit later, and have a balanced microbial composition. So in relation to amino acids, really what's important here is protein synthesis and turnover. We know that there are several different important proteins we want to consider. For instance, looking at catabolism to glutamate, decarboxylation to histamine, as well as the synthesis of carnosine and other histidine-containing dipeptides. Implication of low values here usually indicate impaired protein synthesis, reduced antioxidant capacity, decreased production of histamine, altered gut microbial composition, increased inflammation and oxidative stress, and even potential negative consequences on glycemic control. High values usually show enhanced antioxidant capacity, increased histamine production, improved gut microbial composition, potential improvement in glycemic control, as well as enhancement of specific cells that help peristalsis, and then also possible beneficial modulation of immune responses. So some examples include histidine catabolism, histamine production, carnosine synthesis, broad microbial metabolism, as well as increase in mucosal-associated invariant T cells, which may play a role in improving glycemic control, as I mentioned earlier. So looking at digital twinning in this domain, of course, a common intervention for a lot of individuals is probiotics. However, this really does need to be targeted when we're addressing specific metabolites, or with the microbiome test, specific microorganisms. So in this case, we're taking specific species from Lactobacillus and Bifidobacterium, which are known to enhance microbial conversion of tryptophan to indole derivatives. Here, this strengthens gut epithelial barrier function, specifically by stimulating mucus production and regulating immune responses. So this redirects tryptophan metabolism from systemic kynurenine production to local indole synthesis, reducing pro-inflammatory metabolite levels. These probiotics can support gut integrity and even mental health, particularly in patients that are experiencing decreases in gut permeability or leaky gut syndrome. So in terms of regulating amino acids, these specific species can help the conversion of histidine into histamine, which also maintain balanced gut motility. And this can help resolve issues like constipation and bloating while stabilizing immune responses. So normalizing histamine production can help support gut microbial equilibrium by preventing both excessive and deficient histamine levels. We want to make sure that we avoid in patients with histamine intolerance, we might consider alternative strains to avoid exacerbation of these symptoms. So in terms of dietary modifications, we want to make sure that we're providing tryptophan-rich diets to support indole pathways. This can include foods like turkey, eggs, and spinach to boost the substrate availability for microbial interactions. This can improve gut-brain axis communication by enhancing serotonin precursor levels and reducing systemic inflammation via indole derivatives. We also want to ensure that we're getting adequate fiber intake alongside these tryptophan-rich foods to optimize microbial metabolism and prevent constipation. So different fiber supplementation can be prebiotic fibers such as inulin, psyllium. These help promote the growth of specific gut bacteria that can better metabolize amino acids efficiently. And this can help support increased diversity and short-chain fatty acid production, which we know plays a large role in increasing gut barrier health and reducing permeability. We want to make sure that we gradually introduce fiber because if you start from a very low fiber intake that we see in Western populations, like about an average of 15 grams per day, and you go up to recommendation of, say, 35 grams per day, you're going to experience some discomfort. So we titrate the individual up in fiber over time so they don't get the symptomology that is often associated with that. So to sum up, the gut domain, we know that the gut plays a central role in health. Its key impacts extend beyond just the gastrointestinal tract, gut permeability, but even affect mental health, systemic inflammation, and chronic disease risk. So important metabolites to monitor are the tryptophan metabolites, amino acids, as well as short-chain fatty acids, because these are really a good indicator for microbial diversity and metabolic health. Some important interventions that we use in our digital twinning models include probiotic strategies, heavily reliant on dietary modifications, as we know that this plays probably one of the major roles in gut health, and as well as supplementation approaches. In certain cases, amino acids like glutamine may be indicated. And because of the complexity of our models and how many interventions we can draw from, and also the depth that we get with our metabolite monitoring, we're able to provide real-time feedback to provide really personalized recommendations for optimal gut health outcomes.